I want to talk about iron deficiency anemia. In patients that some patients that they do see the family doctor or the GP or polyclinic or the healthy SGL to do health screening. Some of them are diagnosed to have anemia. When you're anemia, that means low in hemoglobin or red cell count. Your doctor will ask, we do further tests. And one of the tests is check out the iron. So today we'll specifically talk about iron deficiency anemia. That means the hemoglobin is low. For men it's 13, for women about 11.5. If your hemoglobin is low and the iron store is low, either the iron is low or the ferritin is low or the iron transference saturation is less than 20%, we define it as iron deficiency anemia. So if iron deficiency anemia, you see a doctor, we think of two broad categories. Are you not eating enough iron, or are you losing the iron that is blood somewhere? Who are the people that don't take enough iron? I have many patients that they are vegan, they are vegetarian, they don't take meat. Meat are very healthy food. They have iron, that's why they're red colored in the myoglobin. So if you just take vegetable, you may not have enough iron in the diet. And Singapore or most parts of the world now, we are not so poor as to we don't have enough to eat. So if they have dietary low in iron, usually it's because they are choosy in the food, or they are vegan, they are vegetarian, they don't eat meat. So that's one category. Second category is that they're losing the blood somewhere. For young female, they can lose from menses because every month they have menstruation, and sometimes they get pregnant. When they're pregnant, all the goodie from the mother go to the baby, including calcium, vitamins, and iron. So for female who are pregnant, very common, we find that they are iron deficiency and they have anemia. So most of the obstetrician will give the pregnant woman iron pill or ask them to take a high meat diet. So pregnancy is one thing, menstruation is one thing. Then if that's a negative, then we talk about whether they have heavy menses. Most women menstruate, most women menstruating maybe 4 to 5 days. They may have clot on day 2. Some women have heavy menses than others. Some have clot for more than 1 day. They have 2 streaks of clot. And some patients' menses last for 1 week or even 10 days. So if they have excessive menses, they can obviously lose more blood. If there's no menstrual loss, then we have to ask them whether they have any digestive tract problem, which is why patients come to me. So if they have a mouth ulcer, esophagitis from reflux, gastritis, Helicobacter pylori infection, stomach cancer, stomach ulcer, or colon polyp or colon cancer, they can be losing blood because they bleed from the inside, and they can have iron deficiency anemia. So and they will need further tests like upper and lower endoscopy check. To sum up, if somebody had iron deficient anemia, we think about whether they're not eating enough, either they're vegan or because they're losing the blood somewhere. If they're young female, there's probably menses and pregnancy. If they're post-menopausal female or they are male, then we think about whether they are losing blood from the digestive tract. And yes, we do pick up Helicobacter pylori gastritis, esophagitis, gastric ulcer, stomach cancer and colon cancer, large colon polyp, etc. So if you are diagnosed with iron deficient anemia, do not wait. Your doctor will normally recommend you to see a specialist, usually either a blood specialist or a gastroenterologist. So do take note that endoscopy is usually indicated when you have iron deficient anemia without a good reason. This is Dr. Desmond White, gastroenterologist.